Okay, so just, actually before I get started, just to give everyone a little bit of background, if you're not familiar with me, but just in relation to Medicare. So I'm very familiar with Medicare and individual group insurance benefits, health insurance benefits, long-term care insurance benefits. I have licenses, we don't sell, but my background, I was intensive care nurse. Then I went into home care, and that's where Medicare really, I started realizing the insurance side of healthcare. And then ended up moving and working for a managed care company, Tufts Health Plan. And that's where I really got to understand the benefits on all ages. But on the Medicare side, especially, I worked for part of my job was a case manager for a managed Medicare product. So I became very familiar with the Medicare Advantage program and, understanding the prescription drug side, although at that time, Medicare didn't offer prescription drug benefits. So I'm gonna get started and get into more detail about that. So I make sure, okay, there we go. So I'm gonna minimize this screen up here. There we go. Okay, so this is when we say 2021 open enrollment, this means that starting October 15th through December 7th, you will be able to start looking at the Medicare Advantage and Medicare Part D plans for 2021. This is for people who are currently enrolled in Medicare. And it's an opportunity for them to find the best plan for their needs. And that's why we're here today, is really to talk about how to do that. This is not for people who are just turning 65 and becoming eligible for Medicare. That's an initial enrollment period. There's many other different enrollment periods. They've added 2 different new special enrollment periods, but the special enrollment periods are, say if you're over 65, you're retiring, and you have a life-changing event that makes you eligible for Medicare. That's not this time. This is open enrollment. That's called a special enrollment period, and it happens at all different times according to that life-changing event. And then there's the missed your initial enrollment period and you missed that special enrollment period. That's the annual enrollment period, and that's January through March. So this is not any of those last 3. So we're going to focus on October 15th through December 7th. And with this, you can't call Medicare on December 8th and say, oops, I missed the open enrollment. Can I still enroll in the plan? No, you will have to go to the annual enrollment period if you need to enroll in Medicare. But now this is sort of your sort of last chance. And I can talk about other potential opportunities to change later. Okay, I'm just going to go through an overview. There's a lot of information here, so I'm going to try not to get too bogged down, but a lot of information. Just quickly, there's the original Medicare. This is what was, back from 1940s when they started it, Medicare Part A and Medicare Part B. This is sort of when people say, oh, I signed up for Medicare. So you have hospital medical. You'll see Part B is only 80% coverage. And then you have a Medicare supplement, which is separate from Medicare. These are private plans that you have that option if you'd like to have almost 100% coverage. You can buy a supplement plan. And then they added Part D in 2008. So that Medicare did not offer any prescription drug coverage until 2006. And then you have Medicare, original Medicare. So Part A, most people have paid for that through work. So it's not necessarily free, but there's no premium when you sign up when you're eligible. Part B is premium based, so is Part D. And I'll talk more about that. And Medicare supplement is a premium, but again, that's separate from Medicare. So you're paying the provider or the insurance company directly. Then there's Medicare Advantage plan. That's Medicare combined, everything together in one package. Sometimes Part D is separate, but nowadays it's pretty much all in one, very similar to your regular group insurance plans that you may have had, or an individual type of plan where you combine the hospital, the medical, and then you have all sorts of networks in and out of network. With original Medicare, which I'll talk a little bit more about, is you have providers, medical providers who participate with Medicare. Under the Medicare Advantage, you have the doctors who participate, but then they break it down into smaller networks. Okay, and what you can do at this time during open enrollment period is review your coverage, compare it to other plans, and you have the opportunity to make a change. You can change to under the Medicare Advantage plan. If you are on a Medicare Advantage plan, you can change to a new one. If you're on original Medicare, you can change to an Advantage plan, or if you're on an Advantage plan, you can go back to regular Medicare. Then there's the prescription drug coverage. Same thing, review your coverage, compare it to other 2021 plans, and then you can make a change. With the supplement plans, I'm just going to touch on, but in Connecticut, fortunately, you can change those plans monthly. You just have to make sure you're in a, you have a period of time which you're eligible for the Medicare supplement, and you signed up for it in the past. Okay, how to do this. So how to compare the plans. I'm not going to, if this was longer, the time period, because I only have 20 minutes for this, I would take you into the Medicare website and go through the process and see if I could help you, understand the whole process with reviewing your medications and choosing a new plan. But this is where you should go, and you should set up a login ID and password. You should have a Medicare card. Just make sure you have the newest numbers, or now it's numbers and letters. It's not your Social Security card anymore. So start there, and then you should be able to, there's a tab with finding a new for Plan Finder, and we'll walk you through the steps with questions. So that's sort of where you begin. And then what I'm going to do now is I want you to know really the most important questions to be asking and what you should be looking for when you do go, if you are looking to change plans. Okay, but first I have to let you know, I'm sorry, but stress caused by trying to figure out your health insurance will not be covered by it. All right, that's it. I know you're all laughing, so I'm so happy. Okay, so ready to go. Questions to ask. And just a reminder, the reason to do this is ultimately, you're probably going to save, I don't recommend people changing plans unless they really see that there's benefits worth obtaining through the coverage or significant savings. So that's where the umbrella is really just about expanding your coverage, getting better coverage, and the potential for saving, or it could be just easier to manage. Okay, so I'm going to start with Part D, prescription drug coverage. And this is, as I said, this is sort of Medicare based. If you haven't enrolled in it, there's all sorts of penalties if you're late in doing it. But that's a whole nother discussion about Medicare and how that works. But important to know how long you've been on this plan. And in relation to your coverage or your parents' coverage, because some parents never signed up for Medicare Part D. They had some coverage through their supplement. So you need to make sure they do have a prescription drug plan. Many of them have gotten away with it because they don't have any prescriptions, which is wonderful, but then they get surprised when they get sick. So the other reason to know how long you've been on it or they've been on it is because the premium increases significantly. So as in going into the premium, they become old plans. So the premiums just go up every year. So that's another reason to look into your coverage and your plan and comparing it to other newer plans. not only do the premiums change, but the coverage changes as far as the deductibles and co-pays and what how your prescriptions are covered. So when you go into doing these comparisons, it will show you the comparison of your current plan to the other plans and the premiums and the costs. So you can get a sense. So that's sort of one area where you're going to think about before you make a change. The next is going to be your prescription drug coverage. So you put all your prescriptions in there. You need to know what prescriptions you're actually taking, whether it's the brand name or if it's the generic name. And then you want to look at when you've got your prescriptions in there, you know, what tier are they covered at? Meaning it's sort of as to how really expensive they are. And if there's restrictions related to those prescriptions to receive the coverage under the plan. Restrictions would be quantity limits. You can only get 30 a month, or you cannot get the 90-day supply. And then the other one would be prior authorization. So if you have a medication that the insurance company may or may not approve, the prior authorization is required with your physician filling out a form and sending it to the insurance company. Sometimes that can be a real issue. So if you've had difficulty with other prescriptions and you've had to get prior auth, what you should do is call the new insurance company and find out what needs to be done if you're to switch. And that I would do that if you're looking at, you know, a couple $100 of savings. Honestly, with our clients, I leave it up to them, but I really don't recommend making any change unless they're going to probably save anywhere to $300 to $500 or more a year. But I've saved a client, it was $10,000 that we saved him by changing his plan. So you just really need to understand what is covered. All right, so I think that's it for part D. It's so hard to not have this be a live conversation, but keep pressing on. So let's talk about Medicare Advantage plans. So the Medicare Advantage plans, you know, not as many people are on Medicare Advantage plans in this area, in the Fairfield County or, you know, even Connecticut area. I think it's getting much stronger up north. But the reason being is a lot of the providers are just not participating in these programs. So I will go through it. And again, there's a lot of information, but the difference of these plans versus the original Medicare. Original Medicare does have deductibles. So there is a hospital deductible, but often people get coverage through their subscription, their supplement Medicare Gap plan to cover those deductibles. And they will have co-pays depending on what supplement plan you pay for. But primarily, there's only a hospital deductible, and then there's a small $138 physician outpatient deductible. So under the Medicare Advantage plan, the deductibles, you have more choice when you're choosing, where you can go with those sort of, if you're used to the group coverage, you can go up to $5,600 with a deductible. And that means you pay out of pocket before the plan starts paying. And these deductibles are all different. There's the deductible where it will apply to the hospital side. There's the deductible that applies to outpatient surgery. You really need to understand these plans and look at all the different coverages, because I've had so many people come to me very surprised and not expecting costs, and then they want to appeal it. And as they said, insurance, they will not cover you if you don't understand your plan. So that's your responsibility to understand your benefits. So the next with when you're reviewing the plans and comparing the Medicare Advantage plans, is looking at the premiums and the annual costs. There's a lot of things you can put in your providers. You can search your providers and put them in, and they can give you sort of an idea as to, what your annual costs will be based on your sort of past experience. And you can put your prescriptions in there as well. So that's where you're going to get your premium, your annual costs. Now with Medicare Advantage, you still have to pay your Medicare Part B premium, which I didn't talk about the Social Security side of that, but let's focus on the Medicare Advantage premium right now. So it's it is a separate premium similar to the Medicare Supplement Plan premium. So you're going to have your annual costs, you're going to have a premium. The most important things that you are going to want to look at, and this is going to impact your experience on the plan, is the providers that are in network, knowing if your doctors participate in these plans. So there's in and out of network coverage. So if you have a dermatologist that you went to that does not participate in Medicare at all, so you've come from group insurance and you used to be able to submit those claims to the insurance company, you don't have that anymore. This is now your in and out of network is based on Medicare participating providers only. So I'm going to stop there because it gets kind of confusing if I go into too much more explanation on that. But you just, as I said, you have to understand what the networks are. And then the Medicare Advantage plans also offer other benefits, like, well, a benefit is their prescription drug plan may be separate, but it's usually part of the plan. The other thing that I didn't mention is with the Medicare Advantage and the Part D plan, also important to know if your pharmacy is in network, if it's a preferred provider, because you want to go to the pharmacy that has, either it's your favorite pharmacy, you need to know what the cost differentiation will be, and you can do that, look that up as well. Okay, I got to get moving. So Medicare supplement plans, just quickly, the sort of same questions is looking at, comparing all the different supplement plans. These were all the choices. If you've got parents, or you may have had you may have Plan J or Plan F. Those are older plans, premiums are higher. But the J plan, 100% coverage, and then they added in that you have to have a deductible applied to all private plans. So now Plan G has a deductible on the Part B side only. The other ones are copays and high deductibles, the other plans. And then my other tip to you on the Medicare supplement plans is they do have, some of the plans offer insurance outside of the United States. So Medicare does not cover you if you go outside of the United States. The supplement plans do have a $50,000 benefit, but I do recommend that you get Medicare, get travel insurance if you do go outside of the US. Okay, so if you change plans, important things that you need to do is make sure you get enrollment confirmation, make sure you enrolled in the right plan. And then, oops, that's my timer. I have to stop it. Okay, and then that you pay your premiums. And that is, you can pay your Part D premium, can be taken out of your Social Security check. And then resources. So I wouldn't necessarily call Medicare, but I would go to their website. There's a lot of information there. Local human service departments are providing appointments. So is area agency on aging, which is SWACA in this area in Fairfield County. They are offering free services. So if you want to go down that route, you need to make an appointment as soon as possible because they fill up very quickly. Sorry, I'm going to go back. I just lost my track here, sorry. Brokers, they get paid by the insurance companies. They have restricted options as far as where they can place coverage. And then there's Healthcare Pathfinder, and we provide private, we had clients hire us privately to take them through this whole process and pay us privately. And I guess I will get out of here and stop sharing. Oh, but I do have to finish with it's a suggestion from your healthcare provider. Read one of these jokes every hour. Laughter is the best medicine. And I say you've got to have a sense of humor when it comes to managing your health insurance. And protect yourself and others. Wear a mask, wash your hands, and socially distance. And that's it. And I will stop sharing my screen.
Thank you, Anne.
Thanks. 12:31. I'm sorry, I went over a minute.
Oh no, you're totally fine. Honestly, they usually go over. That's why I was trying to be quick in the beginning. But does anyone have any questions for Anne? You can leave it open for discussion.
I know I have some questions. I guess one is I'm interested in all this from my parents' perspective. They're in their 80s, and when I got out of corporate America, I kind of took over their finances and have been getting that squared away. And then now I'm kind of looking at this, and they're both pretty healthy, but they definitely, I think they've switched to an Advantage plan, and not this year so much, but last year. My father likes to go to the doctor a lot, and so I just felt like, I think they're spending $5,000 or $6,000 a year on copays, which seems excessive to me. Mm-hmm. And I'm just wondering, it sounds like maybe the original Medicare might be better.
Yeah, and it really sort of probably will balance out as far as that's where you're paying premium. And it could end up it could even equal the same amount. So you're looking at what you're doing, they're getting to the $5,600, $5,700 deductible. But what you're not getting if you're on the, say, $200 a month supplement plan, you're not getting the bills. You're not paying the out-of-pocket expenses. You don't have the mystery of, is a surprise bill going to be coming?
Yeah.
And that's your standpoint, or from any, parents, I had clients, they just write checks. And so you don't even know if it's been processed properly.
Yeah, so I've taken on that, and I was going into their Medicare account and looking at all that. But can I set up an account for myself to look at their stuff, or because my father will forget his passcode and then he'll change it, and then now I can't get into his account anymore.
So what you can do is you set it up where the passcodes, and then there's security settings. So that's sort of like, that's what we've been spending the last couple of weeks doing is with our clients is, going in, logging into their prescription drug cover websites, and then figuring out how to get through the security. And it's setting up the security settings so that when he has changed it, you can, the system, and you figure out that you can change password. And you go through it that way, or you can't, I don't recognize this, so that there's different ways of kind of getting into the system. Okay. But you cannot change, once you lock out the account, your dad or mom needs to be on the call with you with the insurance company.
Yeah, that's the challenging thing. They don't, whenever I'm ready to deal with it, they're, not available or something, so.
Yeah, I guess what you could do is set it up so that you have where you can have you set up the password, and your dad's going to have to contact you if he wants to get into the system.
Yeah. Okay.
Yeah. But the Medicare Advantage plans also, you know, as I said, if they're generally healthy, the other situation, which I keep hearing from people, is that when they go into the hospital, the Advantage plans are much more aggressive as far as moving them out of the hospital, which is fine, but then getting them through the rehab, getting them home, which is more out of pocket for the members. So again, the traditional Medicare, it's because it's just set up so the hospitals almost get paid a little bit more.
Mm. So
yeah.
that would be the main thing to look at, is really I know they changed to a different Medicare Advantage, I think just this, for 2020. Mm-hmm. But it sounds like really looking at the regular Medicare is something I should do.
Or, maybe there's a better Medicare Advantage plan, with lower deductibles. And again, what you need to look at is the networks, because mm-hmm. again, a lot of people come to us to say, my dad's on this Medicare Advantage plan, and the only nursing facility that's in network is, one of the worst ones nearby. Mm. They don't have the other 3 Medicare contracted providers in their network.
Okay.
So that becomes a real surprise and shocker. And when it comes to that point, you can, it's almost after the fact, but if someone's on a Medicare Advantage plan, they can opt out of the Advantage plan during the year and change back to regular Medicare. So, at least there is that, but it can't happen until the next month.
Okay.
And then if they know that's happening, the Medicare Advantage plans, then you have issues. If they're going to the rehab, Medicare won't pay. I had this Medicare won't pay for it because the Medicare Advantage plan was denying something, and it gets very messy and confusing. Yeah.
So Anne, actually that was one of the questions that I had, and I wanted to make sure that I was understanding you correctly. If you are on original Medicare and you have access to, providers that accept Medicare, and then you move to a Medicare Advantage plan, you're going to have a specific network of participating Medicare providers, and some providers out there that accept Medicare may not be on that provider list. So if you were going to them before and you're now on this Medicare Advantage plan, even though they accept Medicare, they may not be in network, and there is no out-of-network benefit for Medicare Advantage plans. Or are there some Medicare Advantage plans that do have out-of-network benefits?
Oh, some are HMO,
okay,
where they just have a restricted network. And this is how they're zero premium. They don't charge a premium because they have complete control over the doctors,
where you go,
what's going on. And then you have the PPO, if you will, POS, all different names, where you can go out of network, but that out of network doctors have to be participating, or, the par or non-par participating doctors. Yeah. And then again, there's the non-participating doctors who accept Medicare reimbursement. They charge 15% above the Medicare rate. So that's again where the supplement plan will pick up. If you get the, Plan G, it's going to pick up all of those mysteries and surprises, because that Plan G is really like 100% coverage.
Right. But you can only get Plan G with original Medicare, not with a Medicare Advantage plan, right? They're totally, yeah.
Right. And I didn't go into the Medicare Advantage plans. What I say that really are great for is, the people who want to go to, say, Stanford Hospital, have a primary care physician who's in network. They will go to whoever their primary care physician recommends in network, who, they will be discharged to the skilled facility in network, and they don't care. They're not going to question it. If they're fine, with that, And then even these Medicare Advantage plans are now have all these discounts for transportation and helping people get access to care. They were even sending food out to people with, during COVID, people who just didn't have access to care. So they're really, these are, I think plans are I think they're fun. I mean, I worked for one and I loved, the doctors I worked with. I was really followed people from like beginning and end of care, but it tends to be people who can't afford to have options. But again, I think there are very good intentions, but they are also trying to, so the physicians in more detail get paid a certain amount of money per member per month. So they're looking at their numbers to figure out, if someone gets sick, they're looking at how to manage it cost effectively.
Yeah.
So that they're not losing money.
And then if I could just ask you one other question on prescription drugs. And I think I heard you correctly in that, I may be taking Lipitor, which may be a covered drug under one plan and not a covered drug under another plan, even though it may be a widely prescribed medication. So they can do that. Like they can, because your United Healthcare plan, your typical group plan, most prescription drugs are going to be covered at some level. Maybe some have a lower copay than others. No, not necessarily.
Well, not necessarily. I mean, if it's sort of a general, like Synthroid and Lipitor, well, not Lipitor so much anymore, but there's like no cost. But yeah, they tend to be, but it's different tiers. And that's really when it comes into more of the brand name type of medications and where those costs can vary significantly or not even be on plans.
Wow.
So if the prescriptions aren't covered, then they don't even go towards your catastrophic. I didn't even go to the details on how the plan works, let alone figuring out which one to be on. But you really want to get all of the medications, especially the expensive ones, like and then there's specialty. Some plans, you'd have to do mail order and, for certain drugs and where it's specialty, and then others are just a higher tier and all of that. And I didn't get into all the support now that they're offering for people who can't afford their prescriptions. They've got a whole nother link now on the Plan Finder site that helps people get support for issues paying their prescriptions, or if it's a specialty type of drug and getting support through the actual drug company manufacturer.
Wow. Yeah, a lot to consider.
Yeah, I spent 4 hours on video watching open enrollment yesterday. Just every year to see. I mean, they're doing great things. I mean, I have to say the changes have been really wonderful, and the support and marketing, and sort of saying this is your chance. You can do this. But it's the different levels of support. If you just even know when you call in customer service to your insurance company, the different answers you get. And the different levels of kind of the searches that people do. I did one not too long ago with a client, and we were with his retirement. He has sort of retirement benefits, but he was on this Advantage plan, and they had they didn't even go into the provider network, and he was about to sign up for another plan and then hired me to come in and look at it, and his providers and the skilled facilities were not, the skilled facility that he was in was not in network.
Oh, wow.
And they were about to switch him over to that plan.
Yeah.
So big difference. So I don't know if anyone else has questions. Lisa, do you have any more? Take advantage.
It's overwhelming, I think. I want to get access to my father's account again, make sure I can get in and take a look at what he's got. you know, and do some comparisons. So you can compare the original to the other one.
Yeah. Yeah, and make sure what you're doing is you're seeing the new 2021 plan.
Yep.
And comparing it to the other, because some people think to keep going back to their old plan, and the plans change every year.
Okay.
Yeah.
Yeah, I think that's my next step on that. And I'm glad to know the dates because it sounds like I need to get focused on it.
Yeah. Yeah. So, and don't hesitate to call me.